Let us now look at heart disease and pregnancy. And we're going to start out again with a question. A 25-year-old is pregnant for the third time. She is 2 months pregnant. She had rheumatic fever at age 15 and has a systolic murmur. She reports exertional dyspnea. What is the most appropriate instruction for the nurse to give her? 1. Try to be as active as possible, but avoid any activity you find tiring. 2. Carry on all your usual activities, but work at a slower pace. 3. Avoid heavy housework, shopping, stair climbing, and all unnecessary physical effort. Or 4. Get someone to do your housework and stay in bed or a wheelchair. So the question says she has exertional dyspnea, and this is only 2 months pregnant. The best answer is going to be number 3, which gives her very specific instructions. Avoid heavy housework, shopping, stair climbing. That's exertion that causes the dyspnea. So this is very specific in its instructions. Now let's talk a little bit about cardiac disease. If a person has cardiac disease when they're pregnant, very often it's, as in this question, it was a result of rheumatic fever. So rheumatic heart disease is a common cause of heart problems. Other times people were born with congenital heart defects, and that of course increases risks during pregnancy. Very seldom do you see people who have had heart attacks, because most women don't have heart attacks until after their childbearing years. So we're usually talking about valve defects, holes in the heart, either rheumatic fever or congenital heart disease. Now remember that during pregnancy, in the second trimester, you have a 50% increase in your blood volume. So by the end of the second trimester, this is a tremendous load on the heart. And this puts the woman at danger of congestive heart failure, or heart failure as it is sometimes called. Other kinds of concerns, if they have valve defects or holes in the heart, infection may be a concern. So there might be some prophylactic antibiotic therapy. We usually don't want them to gain too much weight because this further increases the cardiac workload. They are at higher risk for anemia than other patients may be. If the patient with heart disease is on anticoagulant therapy, she should go on to heparin before she gets pregnant, because warfarin or Coumadin is something that can cause birth defects. So it's a teratogenic drug. Heparin is not. Heparin does not cross the placenta and does not cause birth defects. Now, a couple of major concerns about heart disease. During labor and delivery, this is, of course, a very strenuous time. And there are 2 schools of thought on labor and delivery for women with heart disease. One says, let them have a normal vaginal delivery with epidural anesthesia and reduce the pushing stage. And for some women, this seems to work well. The idea being that a cesarean section is major abdominal surgery, and that is also stress and trauma to the heart. Other people will say, let's do a cesarean section, they're quite safe, and avoid all stress and strain on the heart. In any event, if a vaginal delivery is attempted, they're probably going to use maybe outlet forceps, vacuum extraction to reduce second stage pushing. Both baby and mom will be monitored. Mom will obviously have additional oxygen. Probably don't use Pitocin on a woman who has cardiac disease. Another big concern for us with the woman with cardiac disease is in the postpartum period. She is still at risk for congestive heart failure up to 48 hours after delivery, until that diuresis diaphoretic phase is well underway. She's also at higher risk for clots, so she certainly will need anti-embolism stockings, possibly prophylactic antibiotics if she has holes in the heart. There's no reason why a woman who has heart disease cannot breastfeed. This does not put additional strain on the heart, and that's sometimes a question they might ask on NCLEX. I thought we'd take a brief look at the classification of heart disease, just in case they give you a question that says there are class 1, 2, 3, or 4. As everything in medicine, the bigger the number, the bigger the problem. So a person with class 1 heart disease, it's known cardiac disease, but they don't have any limitation in activity. Class 2, they have slight limitation in activity. They're comfortable at rest, but activity can cause discomfort. Class 3, any activity causes symptoms. And class 4, they have symptoms of cardiac insufficiency even at rest. Pregnancy is very problematic for patients who have class 3 or class 4 heart defects. Class 1 and even class 2 may deliver uneventfully, but class 3 and 4 it's rather problematic.